Good afternoon, everybody, and welcome to the second of our CPHVA events, where we come together with members and special guests today and colleagues, and we're going to continue to discuss the NMC draft SCPHN standards. In particular today, we're going to consider the programme standards. We've based today's session on feedback from our first session. So we had some excellent feedback from those who attended, and we've incorporated that into today's session. Just to remind everybody, this session today is being recorded, so just to make you aware of that. So I'm joined today by some colleagues from the CPHVA and some special guests, and they will introduce themselves in a moment. But first of all, let me introduce myself. So my name is Amanda Holland, and I am the CPHVA Exec Chair for Wales. My day job is SCPHN Programme Manager at Cardiff University. And I'd like to introduce to you Jane Beech. Jane, your
Sorry, I'm on mute. That's the first one, so we'll get that over with. My name's Jane Beech. I'm the Lead Professional Officer for Regulation.
Thank you, Jane. And Bernadette, would you like to introduce yourself?
Hi, yes, I'm Bernadette Bradley, Programme Leader for the Health Visiting Programme at Glasgow Caledonian University.
Thank you. And Annie? Annie, are you with us? Could you introduce yourselves, please?
Hi, I'm Annie here. I'm the current chair.
Oh, Annie, you've gone on to mute somehow.
I've muted myself a bit as I was speaking. Sorry, I'll start again. I'm Annie here, and I'm chair of the Occupational Professional Group Health Visiting for United CPHVA.
Thank you, Annie. And we also have Sue Lowe. Sue, would you like to introduce yourself?
Good afternoon. I'm Sue Lowe, and I'm a Regional Officer for Health in Unite, and I support the Health Visiting OPC Committee nationally that Annie is chair of. Nice to be here.
Lovely. Nice to have you as well, Sue. Thank you. And last but not least, David, would you like to introduce yourself?
Oh, hi everyone, I'm Dave Monday. I'm a Lead Professional Officer with the Unite the Union in the Health Sector. I wasn't expecting to be on camera tonight. I am just doing the production side of things and have a very busy house with many children running around. So hopefully I won't have any crashes of the computers being knocked on the floor or anything. So nice to see everyone.
Thank you, Dave. And you're not just doing, you've organised this very well today, so thank you very much for all of your hard work and all the work you're doing in the background for us. So we have a very full hour. Bernadette is going to speak first for around 10 minutes and take some questions afterwards around the SSSA in Scotland. I'm also going to speak around that from a Welsh perspective. And then Jane Beech has a lovely presentation where we will also be engaging in some questions, answering through polls as well. So that's very exciting. And towards the end, then we'll have some time where the panel can take some questions from yourselves as well. So please feel free to use the chat box, and we'll look at those questions as we move through this afternoon's session. So Bernadette, I'd like to come to you first of all, please, if you'd like to present. You're just on mute, Bernadette.
You've always got to do it once, haven't you?
Yep, absolutely.
So welcome to this presentation, which will provide you a snapshot of the Once for Scotland approach to transitioning of mentors, sign-off mentors and practice teachers, which from here in will be referred to as eligible practitioners, because that's a lot of words to get round. So where they have been transitioned into the roles of practice supervisors, practice assessors in the context of health visiting in Scotland. Reference will also be made to the role of the academic advisor. And in addition to looking at the transition to the new roles, there'll be information in relation to those practitioners who are not eligible to make the transition, And for the remainder of the presentation and for ease of listening and flow, when practice supervisor, practice assessor and academic assessor are mentioned collectively, they'll be referred to as roles. Okay, next slide please, Dave. So the transition to the roles reflects the changes in nursing to promote contemporary practice that's safe, effective and person-centred. While this has brought about substantial change in undergraduate nursing programmes, to support a seamless transition to post-registration and postgraduate programmes, the tripartite approach to assessment in SCPHN practice mirrors that of undergraduate. The implementation of the new roles demonstrates NMC's commitment to strengthen the assessment of student achievement, an opportunity to widen the student experiences as well, and supporting collaborative working between practice, academia and practice partners. This content will also reflect both part two of the standards, the SSSA, and also the now implemented future nursing standards. But the key documents, as you can see here, that are going to be referred to as a national framework for practice supervisors, practice assessors and academic assessors in Scotland. And then we have the practice learning handbook for practice assessors and practice supervisors as well. So that's going to form the key documents along with reference to the part 3 of the SCPHN draft. On to slide 3, please, Dave. That's it. So national framework document in Scotland is wide and supports the introduction of the regulatory changes. So it's providing guidance which is applicable across undergraduate and postgraduate programmes as well, but it also supports health visitors who are eligible for the transition to the new roles for practice supervision and assessment. The content is designed to prepare and support people into the new roles and to develop practitioners, along with supporting collaborative working between practice partners, practitioners and the AEIs. The framework also includes some national principles for the individual roles, and moving forward provides opportunity for creating innovative opportunities for learning and assessing students. Next slide, please. So from this slide, it's a tripartite approach that we have taken to the student assessment, and briefly the key roles that we have there is the practice supervisor. Their key role is support and supervision. Practice assessor, their key role is information gathering, assessment and decision making. And the academic assessor, the key role is the academic studies and application of theory to practice, and clearly with the student at the centre. So it is only a snapshot, and the documents that are highlighted to you, you can get more information in them as well. They're available at the end online. Next slide, please. So for eligible practitioners, the transition, it seems quite significant and evidence-based, but it's not actually onerous. And it respects current skills, knowledge and experience of the practitioners at the moment. There is an additional framework document that explains the transition process in detail, but ultimately it's a self-declaration form, and it's completed and signed by both the practitioner and the line manager. Now the forum link is there, so it would sort of kind of interrupt and fragment the PowerPoints to actually open it now. So it is available on the PowerPoint if you want to open it yourself, and you'll see how straightforward it is. The other thing to remember is this transitioning process also is evidence for your revalidation. So going on to slide 6, please, Dave. So just to kind of reinforce that there is some recognition of previous skills and knowledge, and this is an extract from the documents that we are using. And as you can see, it's talking about reinforcing the knowledge and skills that we have. It's building on the existing skills, and it's experiencing its value and what people are bringing to the role. So it's by no means like starting to the bottom, going up. It's valuing what we have, building on it and moving forward. And it's about capturing these skills and the transference into the new roles. Next slide, please. So this is a snapshot of what would be offered to practitioners who don't have or aren't a sign-off mentor or practice teacher. So this is an S units that everyone across Scotland are working with, and the first one's looking at roles and responsibilities, and that's kind of introducing the SSSA standards, what the roles and responsibilities are, and introducing them to the tripartite approach. The next unit is learning theory, and that's about building up learning opportunities, the theories around learning and about supporting learners to be independent. It's also about peer and interprofessional learning as well from the students too. The third one is the hold on a second. Creating a positive, sorry, I just want to make sure I got the term right, and everybody's picture was over that part. So creating a positive learning environment, and the focus on that is about evaluating the learning environment. Is it suitable for students? Does it meet the needs of the postgraduate student? What are the tools that are being used? It looks at a variety of tools that can be used, and bearing in mind that these are actually across the board, undergraduate, postgraduate, so they're not specific to health visiting or post-reg. They're specific across the board for the NMC. So those with none of the previous registrations of mentor, sign-off mentor and practice teacher would need to undertake these. It's e-learning and it's done self-directed, and a certificate at the end of all of them. There is also an emphasis on feedback as well, which is one of the gaps that we find when we're actually receiving assessments in for students, both postgrad and undergrad. And it's about supporting the practice assessors and supervisors to record and capture the learning in such a way that it's really overt and explicit, and gives like positive feed forward, as well as like kind of identifying areas that need to be further developed. And also there's a push on and a force on and emphasising equality and diversity within the assessment as well. Another key one is the assessment aspect of it, and that's looking at the processes and the responsibilities that people have, and the setting of skills. And then moving on to the supporting of learners, and it's about supporting them to be like the postgraduate, the post-reg practitioner professionalism, but again, remember these are for undergrad as well. Supporting them with reflection, getting used to tripartite working, and also becoming familiar with raising concerns, which is important across all aspects of nursing. So moving on, please, Dave. So obviously there's challenges. Anytime there comes a change, there's going to be challenges. So particularly when the rules have been implemented back in September 2020 in the midst of COVID pandemic. And I think it's a credit to the workforce that actually it progressed and it went ahead. And some locations as well, we had our health visitor students returning from redeployment just at the point of the new rules being introduced.
2 minutes, Bernadette. 2 minutes.
2 minutes. Yeah. Okie dokie. So many of the challenges was gaps in knowledge in relation to the roles, anxieties that it would be labour intensive, and new documentation. The resolution was mostly through transparency and communication and joined up working and use of evidence. Next slide, please. Positives, among some of the positives was the COVID-19 did actually work well in our favour because there was anxiety around meetups, the different locations, and that resolved the problems in terms of IT. Practitioners, they get the opportunity maybe to be supervisors and not have to be the assessor all the time. So they get to enjoy that bit of nursing that they came in to do to nurture students. The tripartite bit was very strong in terms of working together in the 3 roles. And one of the key aspects is where there's a failing student, it's not a decision that you're making on your own, it's made as a tripartite decision, so there's support there. Next slide, please. Looking at our practice partners, it strengthened relationships there, built on what we already had and added to it, and a lot of joined up working with practice assessors and practice supervisors. The students benefited because they stayed with the same practice teacher, and moving forward with a practice supervisor, they have that one person to continue to go back to, which is reassuring for them. Next slide, please. This just covers some of what the PS need to know and what the PA need to know in terms of the roles, and this is part of the document as well, and that's not to be read out just now, but I've highlighted the expertise for a reason, because they're recognising that that's essential for to be able to take on a role at that level of health visiting. And moving on. Again, this isn't to be read out, so don't worry. It's just to show you the progress, like with reference to what the NMC, the CPN Part 2 of the new standards, what they were talking about in terms of practice assessors and supervisors was a bit generic and implicit. So what we can see here is the suggestions that were made to the NMC, and these have been reflected in 4.6 and 4.7 of the post-registration education standards draft. Okay, and moving on. And there we are. The key message to take away from today, if you can, is that information gathering, assessment and decision making are core to our roles as health visitors. The only things that change are the tools and the context. So it's to take away that thought that we are all experienced in this, and yes, it will take time, and there's no expectation that students who newly qualify in health visiting will come up and take up the role of a practice supervisor or practice assessor, because all the documentation is referring to expertise, familiarity with documentation, familiarity with outcomes, and that takes time for them to get accustomed to. So thank you very much, thanks for listening, and I hope that you found it quite helpful to see how the roles are working in Scotland.
Absolutely. Thank you, Bernadette. Really, really interesting. I'm always interested in how Scotland are approaching things. And, you know, it's very valuable that you've been able to join us today. I actually have a question. We've got some time for a few questions, if that's okay for you. We'll check the chat box. But I'm particularly interested in the e-learning that you're offering there, and thinking, I'm wondering how long one of those units might take, and how long they take all together for somebody to complete from the beginning to the end.
Oh, Annie's got her hand up. You're muted, Annie.
Yeah, just to say, we've agreed that we sit with the practice education facilitators, and I chair a group in our health board in Greater Glasgow and Clyde, and we've allocated 15 hours in total. So that's, I think, been agreed by NHS Education Scotland. So in acute, and that's for the undergraduate assessing and supervising undergraduates. So every nurse moving on to supervisor and assessor, we'd have 15 hours of learning time within the workplace agreed.
Yeah, usually it's around about an hour and a half for each unit, but then there's a period of reflection as you go along as well. So yeah, and then there's a certificate at the end of each unit that you can then take to your place of work.
That's really excellent, and that those sort of taking part in that, they can dip in and out of those various units as well. Yeah. So that does sound very enabling, and the fact, you know, that with the certificate at the end of each one as well. So really interesting to hear about how you're preparing those for their role.
Because I think Annie's aware of this as well, because obviously we work with Annie with the programme, and that's something for students who come onto the programme. They're going to be coming on, potentially being practice assessors and practice supervisors in their own areas of practice. So it'll be a varying experience that we'll have, but our leadership module will accommodate the completion of the e-learning or whatever additional learning that students need to do to be prepared for the role when the time comes. So that would be incorporated into our leadership module.
Oh, that's really, really interesting, Bernadette. I wonder, are there any questions in the chat box, Sue or Annie, for Bernadette?
No, there's none come up at the moment.
Right, yeah.
So I think if people want to, as things occur to them as they go along,
yes,
welcome to pop it in, and I'll keep an eye on that for them. I think maybe, Ben, you might find the comparisons as we go through the countries, that might trigger some checks and questions.
Yeah, absolutely. Jane, did you want to add anything before we move on?
Not at the moment. I think there are some interesting bits. I mean, all of it is interesting, Bernadette. Yes. I just don't mean bits. But I think particularly the bit about sharing decision making when you've got issues with students, that's something I hadn't thought about as a real positive. But I'm also, which I think it'll come up later, about the experience that people need before they can take up these roles, because obviously in England we've had the opposite. We have had kind of, you know, fairly inexperienced health visitors being suggested that they should take on these roles. So but I'm sure we'll cover that later. So thank you.
Oh, wonderful. Thank you, Jane. Okay, Dave, if we could please move on to the next presentation. And this is me. Okay, thank you. So I wanted to briefly discuss over the next 10 minutes how, as a university and as a programme, we're working in partnership with our practice assessors and supervisors. And I put a lovely photograph here of some of our wonderful students that graduated when we could do that face-to-face, you know, 2 years ago. So they're all smiling because they've achieved so well, being supported at the time by practice teachers and continue to be supported so well by practice assessors and supervisors. Next slide, please, Dave. So I have already introduced myself. As I said, my name is Amanda Holland. I am the Chair for Wales with the CPHVA exec. There's my Twitter handle if anyone wants to get in touch with me, or my email if you want to email me directly with anything that I could support or share with colleagues, CPHVA colleagues. So I am the programme manager. So I lead the programme for health visiting at Cardiff University at the School of Healthcare Sciences, and I comment and advise on regulation and sort of education matters in relation to the CPHVA exec role in relation to SCUF and education. My background is I am a registered health visitor and a registered adult nurse as well. I've been in education for over 5 years. Next slide, please, Dave. So as Bernadette has already covered lots of points in relation to the SSSA documentation and so on, and obviously we all know that became effective from last September, and similar to Scotland, we've taken a once for Wales approach, and we've noticed how this has worked quite well, really quite well, particularly for undergraduate nurses and midwives, but there's been more work to do in relation to supporting practice assessors and supervisors for their role in relation to supporting the SCUF student. There seemed to be little focus in relation to that, lots and lots in relation to undergrad, but not so much in relation to postgraduate. So leading up to this point, we realised that not an awful lot was taking place in relation to supporting the postgraduate students, in particular the SCPHN health visiting school nursing students. So I called an all Wales meeting early in 2019, and we had practice teachers attend, we had senior managers to health visitors, our commissioners attended, and my colleagues from the other AEIs attended. And then is when we began discussions around what we thought this could look like in relation to supporting the SCUF student, and how we could look at developing CPD modules, that sort of thing, how we could work together in partnership to prepare practitioners for their role of supporting the students following this new model. So we got together, we had some discussion, we started the ball rolling on that. What was interesting is that our practice partners, there was no actual desire for them to be supported in terms of preparation through CPD modules at the university. So whereas we did provide a practice teacher module to prepare them at the time, that wasn't required for the practice assessor or supervisor, and that obviously is in line with NMC, the NMC requisite too, that nothing like that is required, simply just that generic preparation for whoever takes on that role. So you know, we had that in mind when we were thinking about how we could support practice partners. So in practice, directly, they actually prepared their workforce to take on the role of the practice assessor and practice supervisor following the NMC SSSA standards. Next slide, please, Dave. So that meant that there was a gap, and we wanted to fill that in partnership with our local health board. So my colleagues in the other AEIs and my team as well at the university, working in partnership to meet their needs. What we did in Cardiff University is that we already had a handbook for practice teachers, but we needed that to be updated and relate specifically to practice assessors and supervisors. So that was updated, and that was a handbook that the practice assessor or supervisor could put their hands on and find answers to questions in relation to what their role meant around supporting that student who was taking undertaking the Cardiff University SCPHN programme. Along with that, we developed a 3-hour webinar. So we've held a few of those webinars. One of those commenced before our students started in September. So we tried to prepare in advance the new practice assessors and new supervisors through this webinar, and we continued to deliver these webinars through the year, and in total we've delivered 4. And what these webinars do, we discuss and we relate the SSSA to the role of the practice assessor and supervisor supporting the SCPHN student. So we think about those standards and what that means for that practice assessor and supervisor in relation to supporting the SCPHN student. We then take the practice assessors and supervisors through a walkthrough of the portfolio. So we take them right through the portfolio, picking out particular examples and discussing those in depth and thinking about what that means in relation to their role as practice assessor and supervisor. Another thing that worked very well is that I presented evidence from a quality improvement project that we undertook in 2018. And this examined student clinical portfolios, students' written work, and the, at the time, practice teacher report to justify proficiency. And we gained consent from students and practice teachers at the time to do that. And practice teachers themselves actually led this quality improvement exploration, and they came up with lots of recommendations from that, which I continue to feed forward to new practice assessors and new practice supervisors. So there were many recommendations, I would say possibly about 15, and since that time we've been working on that. The practice assessors and supervisors, the new ones now, have been working on that as well, because we're all wanting to support the students to produce a portfolio of high quality. The other things that we do is offer monthly practice assessor, practice supervisor support drop-in sessions where they come along and we discuss any issues, any concerns. We share stories from across the health boards in Wales, and often one health board will support another health board with some ideas or solutions, and we also update them on where the students are at and what they're doing and how they're finding their experience. And we also then meet with tripartite meetings, the routine tripartite meetings, but we've also added in to this, which is really useful during this time of online engagement, module evaluation meetings. So for every module, we meet with the practice assessor, the academic assessor, the practice supervisor, with the student in the centre of this, and we discuss and evaluate the students' learning for that particular module and their experience, and we all come to an agreement together at that time that the student has fully passed that module and the evaluation documentation is completed. That's a really good opportunity for us to get together regularly. What we also do is we ask the student to email us 2 examples of their written work for that module, and we ask for 2 examples of the practice assessor, practice supervisor report that justifies proficiency, so that we are able to look at the quality of that work, and then myself and my colleagues feedback on that where possible improvements or enhancements could be made. Next slide, please, Dave. 2
minutes, Amanda.
Thank you. So that was all very further information around that, but this has obviously been in place for 6 months now, and what we're finding is that obviously practice assessors and supervisors are working extremely hard under very unique circumstances. A lot are new to the role. Some are previous practice teachers continuing, within this role. So we're always very grateful for the hard work that they're putting in and the way they're being supported in their areas, and continually through ourselves as well. We're finding that the support that we're offering is needed more than ever before, but obviously we anticipated this during this process of change, and our practice partners becoming more familiar with what's expected within this new role. There is still some confusion over the practice assessor and practice supervisor role, which we're often advising on at our monthly meetings and via email and so on and so forth. I'm also being invited to forums where practice assessors and supervisors meet within their health board. So I've been invited to the first one, due to happen early next month. So that's a really positive step for that to be happening as well. Students are reporting that they are experiencing variations in supervision and assessment, and I think that's probably just as individual practitioners are becoming more familiar with their roles and responsibilities. But also our students are experiencing wider learning opportunities as well. They're working within various teams in different environments, and that's been happening during COVID as well, where they are having wider learning opportunities. So that's really positive. I am evaluating the effectiveness of our webinars, and so far those who have responded so far have indicated that the webinar and the things we incorporate within that are very useful, and they actually really enjoy the portfolio examples. So we also give examples of previous students' work and examples of previous practice teachers' written report to justify proficiency. So we share that with the new practice assessors and supervisors, and I also put some of those onto our Learning Central, with consent of the student and the practice teachers at the time. So that's it from me. It's working very well. It's a very busy time as all of that is becoming embedded. I'm really looking forward to the next lot of evaluations so that we can continue to improve this for our students. Thank you, Dave. That's my last slide. Any questions from anybody?
There was one, Amanda, one of our viewers wanted to know if she could have access to that handbook you mentioned. Sounds very interesting.
Okay. I'd certainly, please email me about that. I would need to check. Obviously, it's property of the university, but I'm sure we'd be happy to share. Always share. Happy to share good practice and to benchmark from each other is really a really useful thing to do. Please email me, and my email again is holland.a4@cardiff.ac.uk. Thank you, Sue. Anything else at all?
Yeah, there's another comment just come up. Said a comment, not a question. We offer similar support for the assessors and mentors for PH practitioners that register with UKPHR. I work for Health Education England and coordinate public health practitioners, but the programme is different from SCPHN, and we should, well, she's put we could share the learning, but yeah, I think we'd all agree with that, wouldn't we? Best practice really.
Yes, absolutely. Best practice to share, and in Wales, we have that Once for Wales approach, and I'm sure Bernadette as well in Scotland, where examples are shared. So those sources are always very helpful to dip into, but sometimes not everyone knows that they're available. Yeah.
And then Helen's asked if webinars will continue. I think we've got a programme, haven't we? And it's a matter of making sure that where we've got. So we'll make sure that we've publicised that at the end, haven't we, Amanda?
Yeah, absolutely. We'll remind everyone of the next webinar just before we finish. We have one more of those planned, but I'm sure that that we will organise more from this due to the positive feedback that we receive around this. So great. Well, thank you, Sue. And we can take some more questions at the end if any more come in. Okay, Jane, are you ready to present your work, please?
I am indeed, Dave.
Lovely.
If I could have my presentation up, please. Lovely. Thank you. So obviously what we're here today to talk about is the NMC consultation. Can I have the next slide, please, Dave? So just to remind you, we had the NMC with us last time, I know, but to remind you of the key dates really. So it was launched on the 8th of April, and being mindful of obviously the situation, you know, that you're all working in, the NMC have extended the consultation closing date until the 2nd of August. Unite CPHVA will be doing a written response, and obviously what we're doing today is trying to gather, you know, your thoughts on this so we can feed into that. But we will need any of your comments and, you know, anything you want included in that to be with us by the 19th of July, just so that we can get it, you know, get it all done in time. And what the NMC aim for is that the standards are published in 2022 and that they're adopted by universities by 2023, and the current standards will then be withdrawn in September 2023, which sounds a long way away, but you know, time goes quickly, and it isn't really, is it? Just to note, the NMC have got a series of engagement events. They're doing a webinar today on the SPQ side of the programme, but they've also got drop-ins. They've got a list of drop-ins. I'm not sure how they're going to work, but they're on the website, so do go on to the specific website to have a look. And what I would encourage you to do, although you will be supporting us to do a written response on your behalf, please respond as an individual via the online survey, because the research company will be looking at percentages. So the more people that respond, the more likely it is that concerns and issues will be flagged up. Next slide, please, Dave. But what we're trying to do here is to support you with responding to the consultation. It's kind of, it is easy, but in some ways, you know, it isn't. You can just respond to a particular part of it. So if you want to, you can just respond to the health visiting part. But just to say that unless you disagree or strongly disagree, it doesn't come up with a comments box. So if you want, you know, if there's something you think, well, yes, I really like that aspect, but, you know, I've got some concerns, you will need to say disagree or strongly disagree. So in terms of the draft education standards, all of these areas are within the consultation, but today we're focusing on those that are in bold. Next slide, please, Dave. We are going to be having a poll. So how that works is, when I've just gone through the first bit, I'll ask the question. You'll have 10 seconds to put your response. Just to say, it's an anonymous poll, but we may use the information we've gathered if we write up what we're doing in the journal at a later stage. But it is to help us to be able to develop our response. So in terms of the length of the programme, the NMC are suggesting that they won't specify the length of the programme, because this will allow AEIs and their practice partners more flexibility when they're developing the programmes, and that they can then develop it to whatever length is required on their behalf. So they will decide the length of the programme. So here's our poll. Dave, can we have the first poll? Do you agree or disagree with using this approach to the programme? Okay, that's the 10 seconds up. Thank you, Dave. So let's just have a look. We can obviously discuss this later, but let's have a look. Okay, so quite strongly to disagree. Yeah, that is interesting and not surprising, but we will discuss that at the end. So thank you very much. Next slide, please, Dave. Okay, I was wondering then if you'd done it and I'd missed it. Okay, so now we move on to the level of the programme. So because nursing and midwifery is already degree level, the NMC are stating that you know, a post-reg programme really needs to be at a postgraduate level. They say this will give flexibility for AEIs to determine the academic credits for their curriculum and the programme outcomes as well. So again, let's have a poll. Do you agree or disagree with this position for the level of SCPHN programmes? Okay, that's your 10 seconds up. Thank you very much. And again, shall we just have a quick look at that? Okay, more people agree with that. Again, that's not surprising, but we will discuss that at the end. So thank you very much. Okay, next slide, please, Dave. The NMC have also identified consolidated practice, and what they're suggesting is that the new programme standards won't stipulate a requirement for SCPHNs and SPQs to have a specified period of consolidated practice. Again, they're suggesting that AEIs and the practice partners will have more flexibility to develop programmes that support continuous student achievement of proficiencies, programme outcomes and the qualification to be awarded. Again, do you agree or disagree with this approach on consolidated practice? Okay, it's 10 seconds up. That's the end of that one. Right, let's have a look at this one. That is absolutely what I expected. Yeah, that's no surprise either. But again, we will discuss that a little bit more. Thank you. Next one, please, Dave. Right, now we're moving on to supervision and assessment, and I know Amanda and Bernadette have both spoken about the different approaches that they're using to that. And CPHVA was, we asked the NMC to include a little bit more on this specific element, and this is what we were successful in getting in. So they're suggesting that the supervision and assessment of post-reg SCPHN and SPQ students has to apply with the SSSA standards, but supervisors and practice assessors and academic assessors need to be suitably prepared and need to receive ongoing support to fulfill their roles, because these are post-registration students. So do you agree or disagree with this requirement? Okay, this one will be interesting, so let's have a look at this. Agree. Okay, yes, that's interesting, and again I think we will talk through that a little bit more. Okay, so we'll move on to our final poll now, which again is related to supervision and assessment, and what the NMC are saying here is that practice supervisors and assessors must be able to evidence that they've got prior learning and experience necessary for those roles, and suggest that they should have undertaken a period of preceptorship, either in line with the NMC principles or if there's local and national policies, before they can assume these roles. So again, we're interested to know whether you agree or disagree, or whether you can see any issues with this approach. So let's do our final vote, please. Okay, time's up, I think. Let's have a look at this one. Okay. Yeah, that's really interesting. So that's the end of the polls, and that's the end of the presentation on this aspect. So what we're going to do now, I'll hand back to Amanda and we'll have time for discussion. So thank you very much.
Thank you, Jane. Really interesting, some really interesting results coming up there on the polls. And some, obviously not surprising as well. And I think it's really valuable that you were able to sort of direct our thinking and pick out those elements from the drafts that are available on the NMC website. So I think it's really useful to have that. guidance from you and to summarise some of those very important points. And I think that feedback is really, really useful. I wonder if we have any questions, Sue. Is there anything?
Yeah, we do. Somebody's put their hand up, but what we're asking is that people type into the chat or the question and answer for their question, because obviously with the live stream and the recording, if they could do that. But there is one, which is something that we've all been talking about a lot, is are you assuming the NMC are going to abandon a Band 7 role?
Yes, I mean, that's a difficult one because the NMC are not responsible for banding. So I think the way to say it is that the NMC, they've changed the standards, but that actually didn't mean that employers had to get rid of the role, the role or the title of practice teacher. They had to have people working within those particular, in the different way. But, the standards are in, we can't change that. They were applied to post-registration programs, but that doesn't mean by any means, and the NMC, that was not their intention for employers to use it as an opportunity to downband practice teachers or practice assessors, as they're now known, to a Band 6 role. And of course, as Annie will probably say, in Scotland, all health visitors are Band 7. So that is it's a linked issue, but it's a separate issue. And industrially, CPHVA are challenging that situation in England, because we are saying absolutely that this is a role that actually fits into the Band 7 criteria rather than Band 6. So hopefully what we will do, we'll have members supporting us in that, but that is an issue that's being taken forward on the industrial side. So absolutely.
Lovely, Jane. I can sort of see Annie leaning in towards her camera there. So I feel as though she's got something to say on this matter. Please go ahead.
I think it came up at the online conference last year as well. And it's something that OPC is taking forward really strongly. I mean, yes, I'm in the privileged position, as is Bernadette, that our health visitors, the suite of job descriptions are all at Band 7, from health visitor, what was practice teacher, so the practice assessor, supervisor, and indeed the team leader and the practice development nurse health visiting are all sitting in at the Band 7. That has its own set of issues, I can assure you. But the occupational industrial side will be working very closely with the executive professional side to really stress this. Fundamentally, coming from Scotland and with the needs of our families, I would say the health visiting role needs to be a Band 7 role across the board and across the whole UK. And we hope that you can use exemplars from Scotland and our universal pathway to achieve that. But this level of supervision and learning definitely needs that knowledge and skills, and I suppose that leadership aspect that Bernadette says we are putting into the undergraduate programme, that they will then develop through completing preceptorship and further leadership training in their post within the health boards. So it's really helpful having that whole One for Scotland approach with all the education college, the universities working together. The programmes are postgraduate level within Scotland anyway. So we've been able to really retain that, and we will continue to fight the fight, but we'll use that fight for the OPC across obviously in the OPC I represent the whole of the UK and Ireland, so we will continue to fight that to retain that Band 7 role.
Great example in Scotland again, leading the way with the Band 7s, recognising that expertise, in health visiting professionals. So thank you, Annie. Really, really interesting. Thank you for your feedback on that. Sue, anything else come through?
Yeah, there has. Generally, there's a few comments about the quality, concerns around quality. Sinead wants to know if Wales is challenging the Band 7 position too. I think industrially the Health Visiting Committee is quite clear that we will challenge any down banding, and I think we've been clear on that. Whether you're a school nurse, health visitor, whatever you do as a SCPHN, that expertise needs recognising, especially at the moment where we are quite clear that some organisations are using this as an excuse, and it was not intended for this. That was not its intended purposes. Mary O'Sullivan, school nurse is equally important, always. We are absolutely Mary, we're talking about SCPHN, aren't we? Yeah, mostly concerns about expertise, but I think that's not unexpected, is it? And then Marie has asked, do you find the examples of written reports are rehashed? Little guidance on the preparation for the role, and this can result in inequality in education. How do we solve this?
And so, yeah, I think what I would like to, is what we need to look at is whether what the NMC have put in the draft standards is sufficient to, to protect the quality and to, if you like, to protect the role, and that's what we're asking. Is it sufficient? I know the poll, it's difficult not to agree with those points, and if you like, they were the two questions that when I did the survey concerned me, because of course you agree that practice supervisors and assessors, should be prepared, they should be supported, they should be experienced, but actually is what they've written there sufficient to ensure that happens? I mean, if, from what we've heard today, Wales and Scotland have already got that in place, although I think, Amanda, you're still having to do a lot of support around that. So, that's what we need to look at. We need to be looking at these standards as, providing some protection, and is there anything else that needs to go in there that actually can really shore it up so that newly qualified SCPHNs can't be asked to assess, and we do need to, because we haven't got those standards in England. We can ask HE to do those standards, and maybe that is a route we need to go down as well, but at the moment, because we're looking at the standards consultation, that's what we need to be considering.
And it's a really good opportunity for us to do that, Jane, and it's so important, isn't it, that we have these events and that we pose questions and really think deeply about the consequences of not making the most of these opportunities. If the questions that are coming through now also relevant, this opportunity to take part in the consultation is so important, and that's the best way to have your voices and your opinions heard. So please go onto the website, take part in the consultation, let us know your views and thoughts around some of the points that Jane raised earlier. Really important to do that. We haven't got an awful lot of time left. I'm looking at the clock now. We have six minutes. So Sue, I think, is there anything else that we can answer? Before?
Just very quickly, there's a comment about I do not think it protects enough regarding support. Agrees with Jane's point around the protected time also. Mary comments, if it's not down in black and white, it won't happen, which is why it's so important for us all to be here. The apprenticeships, somebody has put, it's an English issue, I think, and certainly increasing, should not drive the standards, but they do have a say on level of programme length and the amount of practice. So that's something a lot of people haven't considered, isn't it?
Yeah, absolutely. I think there's so much for us to consider, and we could talk for so much longer around these important points, and I think we will look at what's come through today, and that will support us in constructing our next networking event. So all of your comments, any other comments, please put those through to us to support us in developing the next event. Jane, can you remind us when that next event is?
Yes, our next one is on the 18th of May, again 4 till 5, and we thought we'd focus that one on the proficiencies. But just to say that, and I know Sue possibly would say this, we are going to be having local events as well to engage with members locally. So, and that will provide more time for discussion too. So, you know, do get engaged locally with your CPHVA branch, because we need to, we do need to do this.
I think that's really important, Amanda. It's that constant feedback. We don't want to lead from the top. We absolutely want you to be part of this. But I was in the trust this morning and we had a very frank discussion about preceptorship and support for newly qualifieds. And these are the local conversations with our reps that will make a difference to these standards, because then they go back to your colleagues and everybody that's sitting here today and discuss this. And we need to do that locally as well as nationally. So go back and talk about this. It's really important.
Yeah, absolutely. We will be having some events in Wales, and I'm sure that will mirror in England and Scotland and Northern Ireland as well. So yeah, it's really important to have that local feedback, and a good representation from the 4 nations into this is really, really important. We've got a few more minutes left, and I just wondered, another question? Yeah.
So Diane's put quite CYP Public Health Commissioners need to recognise the skills too, to ensure budgets for banding and growth and career pathways are available. That's very pertinent, isn't it, Jane? I think, yeah.
It is, absolutely. Yeah, I know Joanne's said one about return to practice. To be honest, Joanne, I don't know, but I will take that to the NMC and ask them, because yes, return to practice. They will presumably be looking at that in the context of the standards. So I'll take that back.
Okay. Thank you, Jane. And Annie, I can see you want to add. Here we go.
Just on the return to practice, we've very recently, I think Bernadette will be familiar, had returned to practice. We've still been using the SOAR documentation, but really applied the same standards, because you can't ask the assessor to flip-flop of what she's doing. So it's around our learning and experience, and the programme includes that consolidation of practice. So they're working to the same expectation but with different paperwork. The other thing I think on the chat saw a significant amount about school nursing, and not forgetting that. And actually in my role, my job role, that's going to be my driver of recruiting school nursing now in Scotland. And I've got to recruit 57 students within the next 2 years. So we're really going to be using the standards with the assessors, and indeed the sort of, that the assessor will be supporting a wide number of students, a larger number of students, with a lot of supervisors in different areas. So that's going to be really testing the standards here in Greater Glasgow and Clyde. I am excited about it. I'm excited about it for school nursing, but I would perhaps like a future webinar, Jane, just putting a hint in to focus on school nursing.
That would be a marvellous idea. We'd have to look at that, won't we, Jane? And I was going to ask if you could keep us informed of how that work progresses, Annie. So I am aware, just 2 more minutes left. We've probably just got the 1 minute left. I am going to begin to close today's session. I want to thank all of our panelists and everyone who's contributed today. Bernadette, thank you so much for telling us about things in Scotland, and Annie also contributing to that. Thank you, Jane, for your presentation as well. Thank you to Sue for helping us with the questions as well, and most of all to David in the background for supporting our session today as well. If I could please ask you to complete the survey at the end, and we will then look forward to seeing you at our next event. Thank you all so much. Have a lovely evening. Goodbye.
Thank you. Bye.